paralysis will particularly be spastic type because it's an upper motor neuron. We all know that in case of lower motor neuron, we usually get classic, but in case of upper motor neuron lesion, we usually get spastic. And CP is definitely an upper motor type of neuron. So this is the first point to be remembered. Second point is also very important. Whatever the problem is should be confined to a particular part of the body from birth, may not be detected at birth, but it has to be non-progressive. Now, by the word non-progressive I means already affected limb can deteriorate, but new site involvement will not be there. This is very important. Suppose a child came to you with a spastic type of paralysis of the right upper limb at the age of 3 years. Then his or her mother said that at the age of 7 years, now the left lower limb starting to have the similar problem, which was not there before. Now that will exclude the diagnosis of CP because it's a non-progressive disorder. Whatever the problem is will deteriorate over time, but it will not involve newer site of the body. So these two very basic information you need to remember. A typical facial pattern of a cerebral palsy. We will look at it, but you can clearly see, you can clearly feel that he or she is actually not looking at it. It's a vague. It does not indicate anything. He or she may not give full attention to you even when you are trying to get his or her attention. Another important which is very much confused with the term cerebral palsy is autism. Do not confuse with it. I will explain later. Few causes: prenatal, perinatal, postnatal. Infection, preterm, delivery, low birth weight, delayed crying, drowning, anything related to hypoxic brain damage will lead to CP. Doesn't matter what the cause is. The main thing is hypoxic brain damage. Now we all know that the brain neurons do not have the capacity to regenerate. That's why the damage is permanent. And it damaged almost immediately within 1 month of, and we cannot recover it yet now. Maybe in the future we may be able to gain some treatment facilities to regenerate the neurons, but till then the brain will not respond to any treatment. Few types you need to remember. One is how the muscle tones are there. Most of the time, more than 90% cases, it will be spastic type because they are upper motor neuron lesions. But in few instances, if the particular one portion of the brain which is known as cerebellum, if that portion is particularly involved, then initially few CP patients may present with hypotonic situation. But don't worry, even though are hypotonic initially, within 5 to 6 years of age, all hypotonic CP will eventually convert it to spastic CP. So spasticity is the hallmark of a cerebral palsy. And another type is how much of the body is actually involved. If one side is involved, we call it hemiplegia. If all the 4 limbs, especially the lower limbs, are involved but not the trunk, he has a very good neck and head control. But all his upper and lower limbs, especially the lower limbs, are not very much under his control. Then we call it diplegia. And if the 4 limbs along with the trunk are involved, then we call it quadriplegia. So whenever you mention a child with a diagnosis of CP, you need to mention these two types. So I give you an example. It may be a case of spastic diplegic CP. So by the term, you will identify that it's a spastic type and it's a diplegic. That means all these four limbs are involved, especially the lower limbs. So you can clearly have an idea about the current situation of the child. How you will have a suspicion that it may be a case of CP. Start from the birth history. Now these histories are very much unique. Most of the time they are present. The child may be preterm, 7th or 8th month into life they develop, they gave the birth to the world. There may be a delayed cry after the birth. Within 3 to 5 minutes, a child should cry loudly enough to activate his lungs to start the respiration procedure, so the oxygenation to the brain now has started. If it fails to cry within 3 to 5 minutes, then he will have this permanent brain hypoxia. So delayed cry, we actually specifically ask to the mother whether your child cried immediately or not, whether your child has a premature delivery or not, whether that your child has a very low birth weight or not, whether your child needed an ICU support for the first 1 or 2 months in her life. Now people do not readily understand what the ICU stands for. So মামলা আমরা যখন তাদেরকে জিজ্ঞেস করি যে ছোটবেলায় কোনো কাচের ঘরের ভিতরে রেখে দিয়েছিল, তাতেও তারা বলে জি স্যার, বাচ্চাটাকে আমাকে আমার কাছে দেয় না, প্রথম 2-3 সপ্তাহ কাচের ঘরের মধ্যে রেখে দিয়েছি। তাতে আমরা একটা অ্যাজিউম করতে পারি যে হয়তো একটা তার আইসিইউ সাপোর্ট ছোটবেলায় লেগেছে। না, আইসিইউ সাপোর্ট তখনই লাগে যখন তার বেসিক্যালি হাইপোক্সিয়া ডেভেলপ করে এবং অক্সিজেনেশন মেইনটেইন করতে পারে না। অনেকগুলো কাজ বা টেকনিক্যালি দিস ইজ ওয়ান অফ দ্য রিজন। Now this important history during the birth or just after birth are very important because they are the hallmarks of cerebral palsy. If they are not present, but the child is showing all other features of cerebral palsy, please do have a consultation with a neurologist to exclude some other causes also. Because without this critical point, a cerebral palsy should not be diagnosed. So these are very important. Prematurity, delayed flight, low birth weight, initial ICU support. If they are present, then you start to look for what we call developmental milestone delay. Now these are the normal milestones. A child should gain his next stability by 3 to 6 months of age. He or she should be able to sit up from lying position all by himself by the age of 6 to 9 months of age, able to stand 9 to 12 months of age, and able to walk by 12 to 16 months of age. 1 or 2 months earlier or delay is acceptable. Now these are normal milestones of development. But in case of CP, the mother will clearly mention that all are delayed. His child gained his next stability at 9 months of age, able to sit at about 1.5 years of age, able to stand up in about 2 years of age, and able to walk in about 3 to 4 years of age. All she has already accomplished, but not within the physiological time period. And this is what we call delayed milestone of development. Combine these two together, initial birth history and delayed milestone of development. Your clinical diagnosis should come up with cerebral palsy. Now what are the deformities? Why we are so much bothered about it? You think about it like a car. It's a new baby. All his body structures are completely normal and brand new. Only the brain is not functioning properly. It is like a Mercedes car, just driven out of the factory. With a fresh 4 tires, new engine, new headlights, new body. Everything is okay. But unfortunately, the driver who is supposed to drive this car is blind. So this car is born to turn into any accident. CP patient is just like that. His or her body structure has got no abnormality. They are completely, perfectly okay to comply any order given by the brain, but unfortunately the brain is not giving the order. Not only giving the order, but they may give the order in a harmonized way. Now we all know that this is my forearm. There are some agonists and antagonists. When they are both working together simultaneously, that my arm is not going to move. It is going to remain still. If my both agonist and antagonist are now working simultaneously. When my cerebral cortex asks this elbow to flex, the agonist started to increase its power, while the antagonist started to relax. And only that way my elbow moves. The cerebral constipation's brain do not have this function either. So any one of the group, either agonist or the antagonist, will have more action without any control. So most of the time, in all his upper or lower limbs, he will have a flexion attitude, which cannot extend. Now I am standing here with my full lower limb in extended position. They will also stand while flexing each of the joint like this. My hip is flexed, my knee is flexed, my ankle is plantar. I will be able to walk, but it will use up a lot of energy, and the child will fail to walk even from one end to that end of the room within a speculated time. So if this contracture are there, they will have some specific gait disorder, and they are very much unique to cerebral palsy. Let me show few of them. One is what we call jumping gait. Knee hip flexion, knee flexion, ankle remain plantar flexion. Second one is called crouch gait, where the hip and knee will remain in flexion, but instead of plantar, the ankle will remain in dorsiflexion. Third one is scissor gait. While walking, his both lower limb will cross the midline while moving forward. So let us have an example. This is what we call crouch gait. His hip is flexed, knee is flexed, but you can see the foot is completely placed over the ground. The ankle is not raised up, so this is not ankle plantar flexion. This is what we call crouch gait. The opposite one is jumping gait. Again, the hip and knee are flexed, but look at the ankle. He is walking on his toes. That means it is actually a plantar flexion, and this is how he walks. So this is what we typically call jumping. And this one is what we call scissor gait. Look at his limbs. They crosses the midline while moving forward. They crosses the midline to the opposite side while moving forward. Now these gaits can be in a combination also. The jumping or crouching can be in combination with the scissor gait also. And whenever this type of walking you notice, please do consider cerebral palsy in your differential lab and then try to confirm it later. What are the treatments? It's a brain disorder that cannot be reverted back to its normal because the neurons do not regenerate or cannot heal themselves. So the first line is very important to remember. A child with cerebral palsy will become an adult with cerebral palsy. It will coexist. So what we can do for them? Some non-surgical treatments are there. We can give some stretching exercise, so the flexor agonist group can get a little bit relaxed. We can do some serial casting. Even we can give them some brace to make the limbs more straight for better work. Some medical treatments are also there. We usually do not prefer peripheral muscle relaxation because it is coming from the central nervous system. So central acting muscle relaxants are very important for this treatment of cerebral palsy. Most of the time we use either diazepam or dapam. The surgical management is there also. Now, people of Bangladesh have a very good concept in their mind setup that if he or she has undergone any sort of surgery and if the surgery remains uneventful in the post-operative period, everything heals up, he or she will totally get rid of the primary diagnosis. So like an appendicitis. Once the appendicitis is done, I am get rid of appendicitis from the rest of my life. Unfortunately, CP is not like that. I will operate on a limb, which I clearly stated that which is not the cause. Cause is over the central nervous. I do not dare to put my scalp, my blade over there. I am operating on a limb, which is the secondary default. So even if I correct it, it is not going to solve this primary problem. So this is the way to counsel the parents. That after this operation, hopefully your child will walk a little bit better than before, but definitely will not walk normal. This is the way you need to counsel them, and they are quite happy with it. A child who is totally crippled over the bed, who cannot even turn by himself, after the surgery, if he can walk with a crutch or a brace, you should have seen the joy from the eye of the child or from the parents. It is almost like a winning Mount Everest one. So you need to tell them that hopefully the child will walk better than before, but will never walk normal. Best time to do this surgical procedure is at around 8 years of age. If for some reason we need to operate them before 8 years of age, you need to counsel them again that by the age of 13 or 14 years, they may need to be operated back again. Because the child will continue to grow and the muscle will again become spastic because of the growth. It will again become spastic if the child, mother or father or the parents fail to give sufficient exercise after the surgical procedure. That will result back into its original deformity within 6 months of post-operative period. So surgery is definitely not a definitive treatment in case of cerebral palsy, but we can offer them a better life with this surgical procedure. But do not underestimate the non-surgical procedures which comes in form of exercise, braces, some medical drugs. So they are also very good. So remember this key point. Some prenatal, perinatal and postnatal causes either in the form of infection or hypoxia followed by delayed milestone of development will lead into cerebral palsy. It's totally a brain lesion and a non-progressive lesion. If these two criteria do not match, then do not count cerebral palsy as your provisional diagnosis. Keep it in the differential diagnosis, which need to be excluded or included later on. Both non-surgical and surgical treatment can help the child to have a relatively better life, not to be a burden to his parents, to his society. Because if only he can take care of himself or herself by themselves, that is quite a big achievement for both the parents and the society. Thank you.